This meeting is now being recorded.
Hi everyone, and thank you all for attending our webinar this morning. We're really excited to be able to share some information with you all about the Credentialing Verification Organization. I'm Amanda Hudgens, and I am the Director of Special Projects with the Texas Association of Health Plans. And also on the line, I have Laura Malloy and Mina Steer with Aperture. And I also have representatives from all 19 Medicaid health plans available who are going to chime in and answer some questions at the end. So, and as you all know, credentialing is the evaluation of a provider's qualifications and verification that they're in good standing in terms of licensing and certifications. And it's also a way to ensure patient safety and allow them to choose a provider confidently knowing that they've been fully vetted. And so, again, as I just mentioned, we're really excited to get the CVO kicked off. We really feel like it's going to improve and streamline the credentialing process for you all and make your lives a lot easier. And so our first slide, we just wanted to share the vision, which is essentially, what I just mentioned. It's to simplify the credentialing process by reducing administrative burdens for physicians and healthcare providers seeking to participate in the Medicaid program. And we wanted to share some background with you all. So the authority for this project came from the 84th legislative session. It was Senate Bill 200, which was the Sunset Bill, and it contemplated a streamlined process for enrollment and credentialing. And based on that legislation, HHSC agreed to allow Medicaid health plans through TAHP to manage the acquisition of the centralized credentialing entity. And in 2014, the plans along with TMA and HHSC came together to develop some best practices for the CVO. And then in September 2015, TAHP released the final RFP, and Aperture was selected as the vendor in March 2016, and the final contract was awarded in June 2017. And so since that time, we've been working to develop the business rules and the process and just working through some general implementation activities to get us to this point. And so, that's the background. We also wanted to share just some information with you all that this is part of the Uniform Managed Care contract now. It's a requirement for all health plans to use the CVO, so you shouldn't ever encounter a plan that's not participating. And then the next few slides are really just covering some basic terms that we use frequently in the project. So just at a high level, what is a CVO? And so effective April 1st, 2018, the Medicaid NCOs will implement a new NCQA-certified CVO that will be responsible for performing primary source verification for all newly credentialing and recredentialing Medicaid providers that are enrolled or wanting to enroll and participate in Texas Medicaid. What is primary source verification? PSV, for short, is the verification of a provider's reported qualifications by the original source or an approved agent of that source. And so Aperture, our vendor for the CVO, will be performing PSV functions on behalf of all of the NCOs. And just some examples of things that are verified in PSV are the provider's attestation, their work history and education, board certifications, malpractice history, and hospital privileges. Those are just a few examples. And so who is Aperture? As I mentioned, they're our vendor, the CVO, but also just a little bit of background on them. They're the nation's largest CVO, and they provide services all across the country, and they're NCQA and URAC accredited for more than 10 years. And CAQH and Availity, we just wanted to make sure that you guys are aware that these are both going to be available. CAQH will remain available for practitioners and health professionals who currently use it, and a new solution will be offered for ancillaries and facilities through Availity beginning April 2018. And you will also still be able to submit paper applications if that's what you choose to do. And also, this is just covering some kind of basic information. We want to make sure there's no confusion, just around the contracting and enrollment processes. They're two completely different processes, and you still will have to go through both of them. And so the MCO contracting, we want to make sure you guys are aware that credentialing is separate from contracting, and that you will still need to engage with the MCO for all of your contracting needs and provide any additional information to complete the credentialing process. And then in terms of enrollment, providers enrolling in Texas Medicaid and CHIP through TMHP must still follow the processes as provided by TMHP and HHSC, and you must complete the enrollment process prior to credentialing. And this slide is really just kind of walking everyone through the benefits of the CVO. First of all, we're excited because it's going to save time by eliminating duplicative efforts and processes for providers who credential and re-credential separately with multiple MCOs. We're happy to say that we think that it's going to lower administrative costs for providers and MCOs. It's going to streamline all of your re-credentialing dates. So if you're contracted with multiple MCOs and are currently keeping up with different re-credentialing dates, you're only going to have to maintain one date moving forward. And then it's going to utilize CAQH and Availity, and you'll be able to access practitioner credentialing application information, and it'll allow everyone using these portals to easily update and maintain their application information. And this slide is just walking through the initial credentialing process. We just kind of wanted to give you some, step-by-step overview of what's going to happen. So as done today, you'll continue directly contacting the plan that you would like to contract with. Oh no, I think we've had someone put us on mute. Can you guys bear with me for just one moment while I try and... Okay.
All guests have been muted.
So I just put everyone on mute. If you would like to unmute your line, I believe you can push *6 if you have a comment. So, yes, I'll start over again on the slide. So as in today, you'll continue directly contacting the plan you want to contract with, but you won't be submitting your application directly to the plan. The MCO that you contract with will notify Aperture to begin the credentialing process with you, and Aperture will reach out to start the credentialing process, and they will collect all of the necessary information from you. And we just wanted to note that you may still be required to send some information directly to the MCOs. And this is, again, just a little, it's really going over the same process, but we just wanted to also, put it in a flow form. So again, you'll contact the MCO to begin the credentialing process. And as soon as you do that, you'll begin receiving communication from Aperture with instructions on completing the credentialing application, either through CAQH, Availity, or paper. And Aperture will allow 60 days for an application to be submitted, and they'll be sending you reminders every 15 days. And once the application is received, Aperture may reach out to obtain materials required to perform PSV. And once PSV is complete, Aperture will send the PSV results to the MCO, and the application will move forward to the MCO Credentialing Committee for review. And the MCO will notify the provider of the committee results and walk through the next steps. And this is just some information on the re-credentialing process. The steps are very similar to initial credentialing, but there are a few differences. So as you guys all know, re-credentialing is required every 3 years, and providers requiring re-credentialing will be notified by Aperture at least 90 calendar days in advance of the re-credentialing due date. And if you're a current network provider belonging to more than one MCO and have a different re-credentialing effective date with either plan, then your re-credentialing due date will be based on the earliest initial credentialing or re-credentialing effective date. So in essence, you know, your re-credentialing event could be performed earlier than the three-year cycle due to the transition. And providers who are due to be re-credentialed in September will begin receiving notifications to begin the re-credentialing process in April. And here again is a step-by-step, and it starts out the same. You're going to receive a notification from Aperture reminding you of your re-credentialing due date. You'll receive communication from Aperture with instructions on completing the credentialing application again through CAQH or Availity, and you'll have 60 days, and you'll get reminders every 15 days. And once the application is received, Aperture, again, could reach out to you to obtain information needed to perform PSV. And then once PSV is complete, again, they'll be sending the results to the MCO, and the MCO will contact you to talk about the committee results. And we also wanted to share with you all that the plans have come together to create a new facility credentialing application. This means that all MCOs across Texas will use the same application, and you will not need to maintain different applications for facility credentialing with different MCOs. You'll be required to either submit the facility application through Availity or paper. And live training for Availity, if you choose to use that portal, will begin the week of April 2nd through the 6th. And the webinars will be recorded and available for you all to access at any time. And so now I'm going to walk through some questions that we've received from providers, and I'm going to take everyone off mute so I can let the MCOs chime in and help answer these questions.
All guests have been unmuted.
It sounds like we still have someone on hold. Okay, I think that I resolved that. Okay, thank you guys for your patience. So our first question is, which providers will be credentialed through the CVO? And our answer to that is all Medicaid provider types will be credentialed through the CVO, excluding DMOs and providers who are currently credentialed through a delegation. And examples of providers who are credentialed through a delegation include pharmacy benefit managers who are credentialed through a delegation, although pharmacies who provide a medical service such as DME will continue to be credentialed by the MCO and will participate in the CVO. Another example are some of our plans currently credential their behavioral health providers through a BHO, a behavioral health organization. So if that's the case for you, you'll continue to be credentialed through the BHO, but we do have some plans who will be utilizing the CVO for credentialing their behavioral health providers. Does the streamlined credentialing process apply to commercial insurers? And the answer is, at this time, the commercial MCOs are not required to use the CVO, but we're hopeful that we'll be able to expand the CVO to all lines of business for all of the plans. How will I find out the status of my application? Your health plan provider relations team will be able to provide an overall update on your credentialing application status at any point. And also, Aperture will be providing their call center contact information in the notifications you receive if you have questions specifically about your primary source verification status. How will the process work for providers with multiple locations? So practitioners will be credentialed once for all locations, and non-individual providers, examples include facilities and LTSS providers, are credentialed based on location, and only one application per location will be required. And did anyone else have anything to add on that? I thought someone was trying to chime in. Maybe not. Okay. Okay, so what are the rules around expiring licenses? If a license expires during the PSP, Aperture is going to continue to follow up with the third-party verification source until the license is renewed or the final due date the plan requires the PSV to be complete. But we really want to emphasize that it's important for you all to renew your license in a timely manner, ideally a couple of months in advance, because, in essence, the process can't move forward without a license in good standing. So what if I have an application in process with one or more MCO prior to April 1st? And the answer is the MCO will continue to complete re-credentialing activities for applications with an August credentialing committee date, and Aperture will perform PSV on applications with a September credentialing committee date. Will training be available on the process to submit an application? Yes. Availability portal training will begin the week of April 2nd through the 6th, and providers should continue to reach out to their MCO provider relations staff for general credentialing application questions. And this slide is our resources. We just wanted to make sure that you all are aware that all of our notifications, this presentation, and the recording of this webinar will be posted on the TAHP website and also HHSC's website, and all of the health plans will be posting it on their provider pages as well. So you should be able to access multiple sources to get this information. And then I've also received quite a few other questions, and I'm really hoping the plans will help chime in on this part and answer some of them. I'm just going to verbally walk through some of the questions that I've received from providers just over the past couple of weeks. So the first one that I have is where will providers find availability training? And so the availability training will be available on all of the MCO websites. And you can, again, reach out to the provider relations team to help you locate any of that information. And the second question is, will providers need to create a new account with availability for MCOs? And so facility providers who choose to fill out their credentialing application electronically will need to create an account with availability. The functionality to fill out the facility application through CAQH currently does not exist. All other providers can continue to use either CAQH or availability to submit their practitioner credentialing applications. And then we also received a question asking, how will I know if I'm applying with Aperture or availability? And again, so you won't be applying with Aperture at all. Aperture functions as the CVO who performs the primary source verification on behalf of all the plans, and Aperture will be reaching out to you with instructions on how to fill out the application either through CAQH or availability. And so we got another question about licensing delays and how those will impact credentialing. And so we wanted to just let everyone know that the experience with licensing delays won't change as a result of having the CVO. Licenses are a requirement for credentialing and re-credentialing to occur, and any delays in a license will have an impact on the completed application. And until a completed application is received, credentialing cannot begin. So, yes, I mean, having the CVO really will not change your experience with delayed licenses. Will Aperture log in to update CAQH, and I think the question got a little bit confused, but so essentially providers are going to have to log in to either portal CAQH or Availity to complete the information, just as you have done previously. Is Aperture going to be aware of the MCOs that will be obtaining contracts with the state? And the answer to that is, as MCOs obtain a contract, they will notify the universe of providers through their current routine processes. If credentialing is required and it's within the scope of Aperture CVO processes, Aperture will perform these functions. If not within scope, the MCOs are equipped to manage these tasks. And so the next question is, we're receiving notices from Aperture for documents that are in CAQH. Does Aperture log into CAQH to get the requested information? And the answer is yes. Aperture will be able to view CAQH based on the granted access from the respective MCO. The Aperture team members will review CAQH first for any missing data before reaching out to the provider. And so the next question is, does this include Star Plus? And the answer is yes. Star Plus providers will be included in the CVO. And then again, just to reiterate, does this include medical, dental, behavioral health, and vision? So the CVO does not include dental providers and will include all provider types that are not currently credentialed through a delegation. Examples of providers typically credentialed through a delegation include vision, pharmacy, and behavioral health providers. And again, as I mentioned earlier, some of the behavioral health providers will be credentialed through the CVO, but if you're contracted with a plan who uses a BHO to perform your credentialing activities, you'll continue going through that process of getting credentialed through the BHO. And so what is the turnaround time for the completion of credentialing? And the answer to that is the 90-day state-mandated time frame for credentialing will remain in effect. The CVO is we're still going to be following all of the Uniform Managed Care contract requirements, and so you shouldn't experience any delays at all above the 90-day current requirement. We also received a question asking if this applies to psychologists, and the answer is yes. Psychologists are included in the CVO. Does this include acute care? And the answer is yes. Acute care is included in the CVO. And the next question is, for those of us already credentialed with multiple MCOs, we don't need to do anything until contacted by Aperture. And yes, that is correct. Aperture will be reaching out to you with instructions on filling out your credentialing application in your next re-credentialing event. And so for sites that don't have all of their documents posted with a change of ownership past the April-December timeframe, is credentialing allowed into 2019? And so in order to begin the credentialing processes, all MCOs need a completed application, and that includes the change of ownership forms. MCOs have communicated this need to HHSC, and HHSC is expected to assist in communicating the requirements for credentialing-related actions. How can we, the next question, sorry, moving on. How can we find out what date Aperture has for our renewal date? And so Aperture will send a letter 6 months prior to your re-credentialing due date to inform you that it is time to submit an updated application for re-credentialing, and the participating MCOs will have a report which indicates your re-credentialing month. And the next question is, will Aperture and Availity issue instructions on how to get set up correctly? And the answer is Aperture will issue a letter which contains the website and instructions for how to access the Availity portal and Learning Center. There will also be webinars conducted during the first week of April. And our next question is, are the STAR Plus plans posting a list of sites that are deemed to be credentialed? And to my knowledge, the answer to this question is, with the nursing facility changes, there are no known deemed credentialing providers. And as of 4/1, all providers, unless you are a delegated provider, will be credentialed or re-credentialed through the CVO. An example is an IPA. The next question is, we have two different MPIs under the same tax ID. Will we be notified at the same time for re-credentialing for both? And so the answer is, notifications to providers are based on when they are due to be re-credentialed with the MCOs. If both MPIs were previously credentialed at the same time and are the earliest date, they will both receive the notification. And so our next question is, can we reach out to Aperture to get started ahead of time? And the answer is, reaching out ahead won't be necessary. Aperture is going to reach out to you with detailed instructions on submitting the necessary documentation and filling out the application well in advance of any due date that you're going to have. Our next question is, will we need a different Availity account if we are already using them for your billing clearinghouse? And so the answer is, if you are currently using Availity, you will not need to establish a separate account. You'll be adding a new role to allow for the input of the credentialing application data. Availity will have training materials on their website to assist you in the process, and will also be conducting a webinar during the first week of April. The next question is, where can we obtain the paper version of the new facility application? And the answer is that they will be posted on the MCO websites and provider portals, and Aperture will be sending the application to you when they reach out to you about submitting the application. And in addition to that, TAHP will also have the application posted on our website as well. The next question is, can groups have notifications sent to a central location that manages multiple locations? And the answer is yes. The centralized location will need to be reflected in your information to the participating MCO so that outreach is provided to that centralized credentialing location. And the MCO will provide that data to Aperture to ensure the most efficient process for PSE. And the next question we received is Availity specifically for online applications? And the answer is yes. Availity functions as an online application portal. The next question is, does the streamline also mean one fee or multiple fees for each of the different types of Medicaid? And so the answer is no. The CVO introduction applies only to credentialing events and will not impact any current fees associated with enrollment as a Medicaid provider. And the next question is, if the data is not already in Availity, how will Aperture know when it is all input in order to auto-populate the application? And the answer to that is Aperture and Availity have integrated the application data process. When the application is complete and required attachments are loaded to Availity, the data and images will be passed directly to Aperture. And the next question is, under our TIN number, we have 3 NPIs, and within an NPI number, we have several locations. At which level will we be credentialed? And the answer is, this process won't change. Credentialing is performed by license, not NPI or location, unless the different NPIs and locations have different licenses and credentials. And the final question we received is there a list available of the MCOs using Availity? And yes, currently El Paso Health Plan, Cook Children's Health Plan, Parkland Community Health Plan, Scott and White Health Plan, and Texas Children's Health Plan are the MCOs that we have who will be using Availity. And so those are all of the questions I received. Are there any comments from anyone on the line or any of the MCOs? Do you guys have any final information you would like to share?
Hey, Amanda, it's Victoria with American. Can you hear
Victoria?
me?
Yes, I
Hey,
can.
For the last question, I just want to make sure I pull that up and clarify. Are we talking on the practitioner side who will have access into Availity? Excuse me. And for non-practitioner. Okay, yeah, that's correct. I just wanted to clarify that on the facility side, we'll all have access to Availity.
Yes, that's true. Yes.
Right.
All MCOs will be using the Availity portal for the facility application because the functionality isn't currently available in CAQH for facilities. So yes, thank you for helping me clarify that.
You're welcome.
Okay. Well, thank you, everyone. And just as a reminder, our last slide, I posted the websites where you'll be able to access the recording of this webinar and also the presentation and our other notifications. So thank you guys again, and we're really excited to get started on April 1st. We're excited to be able to improve the process and cut down on your administrative burden. So thank you all again, and we'll talk to you soon.